It often starts with something that seems like nothing. A simple cut, a splinter, maybe a hangnail you barely even noticed. But here's the thing. In the incredibly intricate landscape of the hand, a tiny spark of infection can become a devastating blaze faster than almost anywhere else in the body. So today, let's dive into the urgent, high-stakes world of acute hand infections.
And this quote, man, it just nails it. It's from a classic surgical textbook, but it's not just poetic. It's a clinically precise description of the danger. This one idea, fire in dried hay, that's the key to understanding everything we're about to talk about.
So, why the hand? What is it that makes it such a perfect tinderbox for infection? Well, the answer is all in its unique and, honestly, incredibly complex anatomy.
And this shows you exactly what we're talking about. See, your hand isn't just a solid block of tissue. It's full of these potential spaces. Think of them like the gaps between bales of hay in a barn. A tiny puncture wound introduces the spark, the bacteria, and this dried hay anatomy provides the perfect fuel, letting the fire of infection track along these natural planes with terrifying speed.
Okay, and check this out. This cross-section shows you those pathways perfectly. You can see these well-defined compartments, the thenar space over by the thumb, the mid-palmar space right in the center. These aren't just some random names on a diagram, They are literally hidden highways. An infection that kicks off in one spot can travel, totally unseen, through these channels and pop up somewhere else entirely.
So here they are, the major superhighways we're dealing with. You've got the mid-palmar and thenar spaces in the palm itself, the web spaces between your fingers, and then Paronychia space, which is kind of up in the wrist, connecting everything. Knowing this map is absolutely crucial because it tells you exactly where that fire is likely to spread.
Okay, so we get it, it's dangerous. Now, how do we fight the fire? Well, there are some really clear, non-negotiable rules for managing these infections, and they all boil down to one thing: urgency.
Think of it like this. There are 4 pillars of treatment. First, you got to spot the smoke, the early signs of pain and swelling before the fire really gets going and starts killing tissue. Second, and this is the big one, surgical drainage. We'll come right back to that. And then, of course, you will mobilize and elevate the hand to slow things down and control that swelling.
And this right here is probably the single most important rule of all. You can't just throw antibiotics at this problem and hope it goes away. It's like trying to put out a chemical fire with just water. Antibiotics can't get inside a walled-off abscess. The source of the infection, that collection of pus, has to be physically removed. That pus has to come out.
Okay, so let's look at some of these fires in the real world. We'll start with the common little sparks and work our way up to the full-blown infernos that can literally consume a finger or even the whole hand.
All right, on the screen here are 2 super common fingertip infections. On the left, a paronychia. That's an infection of the skin right around your nail. Super annoying for sure, but usually pretty simple. But on the right, you have a felon, and this is a whole different animal. The pulp of your fingertip is divided up into these tiny little compartments by fibrous walls. So when infection gets in there, it acts like a compartment syndrome. The pressure just builds and builds, and it literally chokes off the blood supply, killing the tissue. Same part of the body, totally different level of urgency.
Okay, now we're moving up to one of the real surgical emergencies, Pyogenic Flexor Tenosynovitis, or PFT. Just think of the sheath that surrounds the tendon you use to bend your finger. It's like a sealed, fluid-filled tunnel that runs from your fingertip all the way into your palm. If bacteria gets inside that tunnel, it's got a non-stop expressway to shoot right up your hand, destroying that delicate tendon as it goes. So how do you spot this thing before it's too late? Well, over a century ago, a surgeon named Canaveral described these 4 classic signs, and we still use them today. The whole finger swells up like a sausage. It's held in a slightly bent position. The area over the tendon is tender to the touch. And here's the real kicker. The one sign that's most reliable early on, it hurts like crazy when someone else tries to gently straighten the finger for you. And believe me, the clock is ticking. This table shows just how fast things can go south. In stage 1, you've just got some inflammatory fluid sloshing around. By stage 2, you've got purulent fluid. We're talking actual pus. And by stage 3, well, the tendon itself is starting to die from the pressure and lack of blood supply. The treatment changes dramatically based on which stage you're in.
And depending on that stage, the treatment options are night and day. If you catch it early, you might get away with something called catheter irrigation, basically making a small cut at each end of the tunnel and flushing it out. But if you wait too long, you've got no choice. You have to perform an open drainage, which means laying open that entire sheath just to clean out all the dead and dying tissue.
All right, now let's raise the stakes a bit. We're going to talk about some of the most dangerous fires, not just because of how they spread, but because of how sneaky they are at the start. They can hide the true extent of the damage.
So, let me ask you a question. Forget about sharks, forget about bears. When it comes to your hand, what do you think is the single most dangerous bite a person can get? The answer might surprise you.
The answer? A human bite. Specifically, what happens when someone's fist connects with another person's tooth? It's called a fight bite. And check out the diagram here. Look at how this works. When you make a fist, the skin and the tendon over your knuckle get pulled back. The tooth goes in, injecting bacteria from the mouth directly into the joint. But then, when you relax your hand, the skin and tendon slide back into place, sealing that bacteria deep inside. It's a perfect trap.
And this leads to an absolute, non-negotiable, unbreakable rule in medicine. You never close a human bite wound. Ever. You have to leave it open so it can drain, and it needs to be cleaned out aggressively, usually in an operating room. Closing that wound is like locking the fire inside the building and hoping for the best.
Okay, here's another one that is just terrifyingly dangerous. The high-pressure injection injury. They call it the silent disaster for a very good reason. On the outside, an injury from a paint gun or a grease gun might leave a tiny little pinprick. Looks like nothing. But inside? It is an absolute catastrophe. I mean, we are talking about forces over 1,000 pounds per square inch. That's industrial-level pressure, enough to blast paint, grease, or whatever it is deep into the hand, tracking right along the nerves and blood vessels. This isn't just an infection. It's a massive chemical burn from the inside out that demands immediate, aggressive surgery. The amputation rate for these is tragically high. So let's say you survive. The fire is out, the infection is gone. You'd think the battle is over, right? Wrong. The real long-term enemy of the hand isn't actually the infection, it's the aftermath.
Because ultimately, the final war is against one thing: stiffness. That is the real enemy here. The inflammation, the body's own healing process, it creates scar tissue that's like glue. It sticks your tendons down so they can't slide. It scars up your joints so they can't bend. Even after every last bacterium is gone, the result can be a stiff, useless hand. And in the worst cases, amputation is the only choice left.
And this last thought, I think, just says it all. The hand is this incredible instrument, a functional jewel. An infection is a thief that's trying to steal its movement, its feeling, its entire purpose. For anyone who treats these, the job is to be a firefighter and a guard, to stop that thief before the jewel is lost forever. And that's why this all matters so much. Because a tiny delay, just a moment of hesitation in treating one of these infections, can literally mean the difference between a full recovery and a lifetime of disability.